Ready to go.
Okay, thanks. I always need to remind you all that our meeting's being recorded and live streamed currently. So let's start our meeting. I know we have a couple of folks who aren't going to be able to make it tonight, Dr. Duplan and Sheila and Larry. So we could start with the agenda and look at the minutes from our November meeting. Can I have a motion regarding them?
I'll make it.
Travis? Second, Khaki. Any discussion about the minutes? Okay, all in favor of accepting them as they are? Okay, they're passed then. Thank you. Any changes to the agenda? Anyone have anything to add at this point?
Oh, I'm sorry. I was muted and I was talking and that wasn't doing any good.
Oh.
I do have one comment on the minutes.
Oh, okay.
Yeah, sorry. I was like, why is she saying that? Why didn't she hear me? But I was muted. Near the end, when talking about the strategic planning, it says Khaki noted the behavioral statement provides the opportunity to measure and be accountable. But how do you determine that is what's really happening? Sounds like I was saying that I wasn't trusting the process, but what I was saying was that provides the opportunity to measure and be accountable, and and let us know what's really happening.
Okay.
Do you see what I'm saying?
Mm-hmm. Would you recommend a specific change in the language there, or?
Why don't we just say after the comment, and to know what is really happening?
Okay. Okay. So do we need to vote on this again? The change here?
Technically, I think so.
I think so.
Sorry.
Okay. That's fine. No, thanks. I'm sorry. I didn't see your mouth moving, but
Because we're little.
yeah, so with the change that Khaki's recommending, Karen, do you want to read what you adjusted it to be? I think you're muted.
Yeah.
Khaki noted that the behavioral statement provides the opportunity to know what is really happening, to measure
and be accountable, and to really know and to know what's really happening. I mean, don't take out the measure and accountable.
Okay.
Nice island you're on.
Thank you. Okay, so it's going to read, Khaki noted the behavioral statement provides the opportunity to measure and be accountable to know what is happening, what is really happening, and how do you determine that what's really happening? Well,
no, scratch that.
To know what's really happening, that would be the end of the statement.
Yep.
Okay, so with that change, can I have a motion to accept the minutes? Travis and Stu, all in favor of accepting them now? Okay, thank you. Great. All right, I don't really have a chair's report, so I think we can move on to the subcommittee reports. Elise, I know that Sheila provided you some notes to report on.
Sure. Yeah, I wasn't at the last subcommittee meeting, but Sheila did share her notes. So I'm just going to find them and summarize them. So it sounds like during the meeting, as per Larry's suggestion, Sheila asked all the agencies to talk about the impact on their residents and clients in terms of COVID-19 changes to services and impacts. And so what they reported was that Unity House Residential said that staffing is a real issue, which means that residents can't get out into the community. They're feeling frustrated and they can't see their families. And then Unity House also mentioned that there's been a big impact on staff and there's been a 10% increase in med errors during the pandemic, which is significant, potentially serious. So we appreciate their candor there. Unity House Day Services, and that was the residential services report. Their day services programs are slowly coming back. They have people on a limited schedule. They're doing their best to facilitate socialization to whatever extent they can. They're trying to do virtual events to whatever extent they can, and meetups on Zoom, and just trying to prevent people from feeling isolated. They're not doing walks right now or park days, and they're working ways to keep people engaged, doing things like sit and fit. And so overall, quality of life issues. The Cco Life Plan just said they're working to make sure that people are staying safe and healthy. Challenge actually closed for 2 weeks before Thanksgiving as a precautionary measure, and I wasn't there, so I'm not exactly sure what that is in relation to. They've said that a lot of the people that they provide employment supports to were laid off from hospitality jobs and hotels and restaurants, and they may not go back to work for quite some time. So they've been offering job readiness classes via Zoom. They just talk about general COVID fatigue, and just trying to maintain everybody through that. The school district, they've had an increase in requests for in-person instruction for special education. So they're bringing back students slowly when they have spots, and they're trying to provide students with disabilities in on-site instruction, in-person instruction 4 days a week as they are able. And Racker, unfortunately, at the time of this report, had said that they had no COVID in any of their houses to date, but that they had a quarantine issue. And unfortunately, we all know now that I'm not sure if it's the same house that was quarantined, I'm assuming so, it turned into, so far, 1 fatality and 2 critically ill, according to the last update. So that's extremely unfortunate. And then the only other update was from the Youth Bureau. They said they're trying to offer in-person programs with precautionary measures as they are able. So significant impacts on people with developmental disabilities in the county.
Any thoughts, questions to come up? Okay, thanks, Elise. Tom, would you want to share an update?
I'm not sure anybody can hear me.
Yeah, I think we can hear you. Can't see you, but.
This thing is, I'd have better chance of breaking into Fort Knox, and I can get out. Anyway, I had a session here a month ago when I couldn't get online, so Stu ran the meeting for me. I was a spectator, so the same thing happened today. Anyway, in January, Nancy Reynolds of Ithaca College will present the IC programs. She'll share their AOD strategies and initiatives and discuss the basics model. It should be very interesting. The basics is an integration of individual and group counseling derived from the self-help programs that seems to be very suitable for a college population. So this will be very interesting. So yeah, that's about it from here. Thank you.
Okay, thanks. Paula, I don't know if you were at the meeting with Larry wasn't able to be here tonight at the last minute. So I don't know if you were in a position to comment on the meeting. I think you're muted right now.
No, and he didn't send anything, so
Okay, thanks.
sorry.
No problem. Frank, is there anything from the mental health subcommittee that,
I'm pretty sure I was at it, but I can't tell you right now what we talked about.
That's
I'm
sort
sorry.
of the position I'm in. I was there, and if somebody like gave me just a little hint about what it was about, sure, I could tell you the whole thing. Maybe Karen.
He had two presenters. He had J.R. Claiborne from the Veterans Administration, and he also had Rich Shore talking about the AOT process.
Okay, well, I'm sorry that Rich is not here tonight.
well, maybe next month we'll ask Larry to give us a double report, and that's probably the best we can do tonight on
Yeah,
that.
I mean, I remember, I don't really remember, you know, he talked about keeping in contact with veterans and trying to figure out programs and how to reach people.
Sure.
Sorry.
Thank you. No problem. Thanks, Karen.
You're welcome.
Sure. Okay, well, thanks, everybody. So why don't we go into Frank's report? Oh, Stu?
Yeah, I just wanted to bring up, it was a tough meeting with people coming and going with the Zoom having its effect on many members. But one piece to point out is we had two speakers and one of them didn't show up, but the relatively new head of the Tompkins County Probation Department came and reviewed the status of what the county is doing. Really no major changes, but just the fact that he's in charge and dealing with the COVID, coming up with different situations on how to negotiate that. But
Okay.
he was in attendance at our last sub meeting.
It was Dan Cornell was the.
Dan, right? Yeah, Dan Cornell. It's been there a number of years. I didn't even realize that Pat retired, the former director.
Well, at least because I knew him when I was a clinician. I was a clinician and I dealt with him all the time, and was a great guy to work with.
Yeah, I was happy that he's got that position.
Great.
Jerry Dietz is the one to show up. Jerry and I will have a conversation about it being a no-show. So
Right.
he may show at another meeting.
Yeah, he's out there in the community. I was surprised he didn't.
Yeah.
No show.
Yeah.
All right. Okay. Well, thank you. Thanks, Stu, for that update. Frank, are you set to go for a commissioner's report?
Yep. All good,
Thanks.
Mary. So a couple things first, Mandy, welcome again. And we had a chance to do a little bit of orientation, although a truncated one, but covered a lot of good information to get Mandy oriented. And I left the door open for any follow-up conversation that she might want to have. So I told her to reach out to the board chair, the committee chairs, if she had any questions. Other than me as well. And then also she said she's going to try and attend some of the subcommittees to get a feel for them when she can with her schedule. And so we're going to invite her to those as well. So welcome again, Mandy. Happy to have you on board. Deputy Harmony has accepted, and we're fully through announcing that. Her first day with us will be March 9th. She wanted to have, being an executive director of an organization, she wanted to have time to help transition there as well, which we completely respect. And well, we'd love to have had her yesterday. We'll, a couple of more months will allow her to comfortably transition. So we're excited about that. Have announced it to staff, so they're all aware. We will do a press release when she arrives here in March. And she's also agreed to try and participate in the next 2 community services board meetings. So you'll see her back in a different role. So speaking of that, next month, Jason Molino is going to come and talk about the public safety reform process and kind of where it stands and what role and opportunity this group and the folks that we partner with might have. So he'll be on the agenda for next month. So hopefully everybody will be able to join for that. We're plugging away in the department, made some minor changes to kind of cohort some folks together, really trying to make sure that folks are staying separated and we limit potential exposures if we were to have someone, but staff is still doing an amazing job providing services. We have seen a pretty significant uptake in new intakes. And so we've actually made some adjustments to our intake process to account for that, so we could get folks in as quickly as possible. We had a new nurse practitioner start on December 28th. Anne, and I'm blanking on her last name at the moment, started with us, and we're getting her settled in, and she's starting to see patients, so that's great to have her on board. We're still working with Dr. Miller. She's got to get her LLC all set up in Texas, and then we'll be contracting with her. But in the interim, she's been so gracious that she's been coming back to the county every few weeks to continue continuity of care with her clients while we work out the legal issues. The one thing I was not aware of is that if you employ someone and they work in another state for more than a week, you have to do all kinds of legal stuff with that state to register as an employer, and it is just craziness. Particularly in this new Zoom created world, what you have to go through. So in order for her to stay an employee and have all the protections of being an employee, she's traveled back to New York on multiple occasions to see clients while we work out the telemedicine piece, but we'll be excited to have her on board. I don't know if I've told this group, but Dr. Lippert has taken the early retirement incentive from the county. And so technically he retired at the end of the year, but he's staying around. He's agreed to stay on in a part-time role 3+ days a week to serve as medical director and continue to provide provide service to clients while we look for a permanent psychiatrist position, which we're advertising for. So if you know anybody, send them our way. So we're actually doing pretty good with prescriber or medical staff levels. We're actually above where we were, I guess, a year ago at this time. So that's the good news, but we still have to plan for Dr. Lippert's ultimate departure from the clinic. Yeah, so I think that's the department stuff. I've continued to meet with mental health and substance use providers. I think you heard from committee reports. Everyone's challenged right now, both financially, staff. I think what we heard is staff stress is at all-time highs, right? This is already difficult work to do, and then you add in all of the stressors of trying to do it from a remote fashion, as well as the impact this is having on all of us personally and with our families too. So it's definitely been trying times, and everyone's trying to support their staff as best they can. We are getting, the state has told us that the budget withholds are going to continue. So all of the programs are expected, to have another 20% reduction. That does not include residential programming. So they've excluded residential programming from those cuts. So I think our state aid letter came in today, but Jeremy hasn't had a chance to review it yet to kind of get that official what the numbers are. But we've been communicating very closely with all of the providers, so they're aware of what to expect. And then obviously when the governor does his state budget, that will be the first kind of real opening the door to what he's thinking about how he's going to address the budget shortfall. So we'll be anxiously awaiting that coming out later. I think the end of the month is when he usually releases it. COVID. Oh, sorry, Stu, you have a question?
Yeah, I try not to watch the news as much as I should try to watch not the news. Has there been any funding for the state and local municipalities? It's been in a bunch of budgets. Did that go through?
Yeah, so they did pass a new stimulus bill, but it did not include aid to states and municipalities. So
All right.
Good news.
Since we had a stop,
Sure.
am I muted again or not?
I can hear you.
No.
We can hear you.
That means we have an open seat on the board then. So then Harmony is,
Yes. Yeah. I don't know that she's officially submitted her resignation, but she will need to. So there is an open seat on the board.
so I didn't know if somebody might reach out to, if there was anybody left in those who had applied that, I mean, as they were going to various subcommittees and things like that, I don't know if there was anybody left. Thought that might be a starting point.
Yeah,
We're having a, go ahead.
That we had to turn down, but we'll talk about that later.
So continuing on to COVID, it's been a crazy week. I don't remember the last time I talked to you all, but I've been on all vaccinations all day since probably last Tuesday, trying to get prepared. We are in the process of announcing, I'm trying to get a press release done in the middle of talking with all of you. We're having, in partnership with Cco Health Systems, we'll be having pods or points of dispensing Wednesday, Thursday, and Friday of this week for the expanded phase 1A, which now includes healthcare workers outside of the hospital that are providing patient-facing care. So anyone that's having face-to-face contact with a patient is now eligible. That includes behavioral health providers. So they are eligible. The county webpage now has a vaccination page connected to it, so you can go there, see what the eligibility criteria are, and there is a link for registration for those clinics this week. Cco Health Systems put out a letter from Dr. Evelyn this morning to the network of healthcare providers that they have access to, and that's not just Ithaca Health System providers, it's all of the providers that interact with the hospital. So trying to get the word out as widely as we could before we do a press release, which will then open it up to the broader region if folks so choose. We can't have a residency requirement for the county, so we wanted to give a day's head start for our folks to get registered. Our plan is to try to vaccinate almost 2,000 people over those 3 days. So we were able to use the health department's allocation of vaccine and have it directed to the hospital so we could partner with them to put this on. It's a big endeavor. We did one on Tuesday of last week for the more restricted phase 1A group, and we were able to do 390 people over the course of that day, but we had appointments available for 600. So we definitely had the capacity and are confident we'll be able to do it. So that registration is now open and a press release will be going out either this evening if we can get it put together or in the morning to more widely advertise that. The pod is happening at the mall in the old Sears building. So Cco Health System has gotten access to that entire Sears department store. And so we've been able to set up the vaccination clinic there. You have to be observed for 15 minutes after getting the vaccine. So it doesn't really set up for a drive-through type setup. So it is kind of come in, go through a check-in phase and then get vaccinated. And then there's a place to sit for the 15 minutes for observation. So that's exciting. We're moving along. We're getting a million questions about who's eligible and when they're eligible. And really what we're trying to do now that the web page is up is point people there. The eligibility is fairly straightforward about who can get the vaccine now. We'll continually update that as we go so we can so that way people will know, so they should check back frequently. The links to registration will be there as well. So as we open future pods, that will be available for folks. So I would imagine, well, we're going to get the word out to our behavioral health providers as well. Many of them should have gotten the direct notification from the hospital, but we'll be doubling on that tomorrow to make sure that they're aware that their folks are eligible. It's important to point out that if somebody is not a healthcare provider, meaning a licensed professional of some sort, They can still be eligible if they work in a doctor's office if they're patient facing. So think the receptionist, when you go to your primary care office, that person would be eligible because they're patient facing. So that's this week. Next week, the eligibility expands to include hospice workers that are not a licensed medical professional. It also includes direct consumer care aides that go into the home. So that's an important group for us as well. That'll be added next week. So that criteria is also on the webpage, letting people know what's coming next week. We have to see how much vaccine we're going to get. It took some convincing this weekend to get the state to agree to give us this much. You may have seen the governor in the news that it's not going as quickly as we might want it to. And my biased opinion is because they went around health departments and went to the hospital systems who aren't used to doing this. And they're realizing that that might not have been the best course of action. We're extremely fortunate that our hospital system is very responsive and did a great job getting their vaccine administered. But partnering with them, with our experience and their capacity, is really putting us in this position to be able to do this many vaccines, coming this week. So we're confident we'll be able to pull it off, and we're hopeful that when we do, it'll demonstrate to the state that we have the capability and the capacity to do this. So sending us vaccine is a good idea. But we won't know that for certain until they tell us that it's coming. So all of this is very fluid. As it goes, our commitment is that we're going to make it known that we can do a significant amount of vaccinations and continue to advocate to get that vaccine so we can do it. On the disease, sorry, go ahead, Elise.
Oh, so I just have a comment. So for personal reasons, because my husband falls in this category, I've gone down the rabbit hole of trying to define critical infrastructure worker and looking at a lot of federal guidance on that. And what I've discovered is that it's incredibly broad and could encompass probably about 50% of the population. So I guess I'm just bringing that up to say that I think there's going to need to be some real effort to clarify what is thought of locally as a critical infrastructure worker, because it had things like bicycle repair people on the list. And in terms of prioritization, maybe bicycle repair people don't fall into that category.
Yeah, the state has been doing that. So we're not into phase 1B yet, and we're still several weeks from getting to that essential worker classification. My expectation is the state is going to clarify that, and there's going to be a phase 1B .1, phase 1B .2, right, as they identify additional criteria, because they've done it in phase 1A. Right, so everyone that we're talking about, even including next week, all fit into phase 1A, but we didn't have enough vaccine for all of that. So they've given us very specific guidance, quite frankly, to a point where it's limited the ability for people to give vaccine out because there's not enough interested folks in the limited categories they're establishing. So I do expect that there will be clarity. There will be some clarification on what happens as each week we progress. And that's the approach the state is taking, is each week they're moving on to additional people being eligible. And I expect that will happen in phase 1B as well. But I agree with you, essential worker, we've called almost everybody an essential worker in the last 9 months. So there has to be some narrowing down of that, so it's more clear.
Yeah, it's very broad.
Yeah. Just quickly on the disease side of things, things are, the last few days have not been bad, but I would caution that the sampling sites were only a half day on Thursday. They were closed on Friday, half day on Saturday at the mall, half day on Sunday at the mall. So what we're seeing is the results of significantly less testing. Probably the next 2 or 3 days will give us a glimpse into what Christmas did. because the timing will be right at that point, and we'll be back to vaccinating full days worth of clinics. So, hang in there for a few more days, and then we should have an idea on what Christmas looks like. The schools are heading back into session. Many of them have the K through 12, many of them have decided to stay remote. Ithaca City has not, so they are back in person, but they have also begun to do screening testing. So they're doing the antigen rapid tests that the state sent that were initially earmarked for those places that were in a cluster zone. But Ithaca has chosen to be proactive and do some surveillance testing of their population. So they're testing as if they were in a yellow zone, doing 20% of their population every 2 weeks. As they come back into session. So lots of stuff still happening COVID related, but it's starting to feel like there's a light at the end of the tunnel, and there is some enthusiasm around getting people vaccinated. I think one of our biggest challenges is going to be convincing people to get vaccinated. And I think that's all I had, Mary. I'll stop talking.
Any other questions for Frank? Anecdotally, Frank, what do you hear about resistance to vaccines locally?
Myself on mute. Yeah, I honestly, I've been a little bit surprised at the level of hesitancy in the healthcare workforce. I expected it when we moved further out into the general population, but I thought for sure we wouldn't see as much. I think here locally, we're probably doing better than some of the uptake in the surrounding counties around us. But it is, there are still people that are concerned for a myriad of reasons and are choosing to either not get vaccinated or to delay vaccination. So we'll know more in the next few weeks about what uptake looks like as we start to do, more larger numbers. And we'll have a better feel for it. But we're prepared to do some pretty significant public information work in the next few weeks.
Paula?
Yeah, I've talked to a number of people, and I've been really surprised at how many of the people I've talked to don't understand how a vaccine works. Or even, like the flu shot. I was talking to somebody who couldn't decide if they should get a flu shot, and they had some kind of injury, and they said, well, won't the vaccine go to the weakest part of my body? And so I need to wait till, and I said, that's not really how it works. But I was kind of shocked that this is a fairly educated person who just didn't know how a vaccine works. So I think even just basic, not just talking about this vaccine, but just how people don't know that stuff.
Yeah, no, I think that's fair. And I think, why would we know how a vaccine works, right? Once we get them as a child, there's, other than the flu shot, that, unless you're doing something very pointed like traveling internationally or have had an exposure, you're not really getting vaccines all that often. And so,
Or you get older, then they start giving you vaccines.
Then they give them again, right? Yeah. So yeah, I do hear you though, Paula, and we have the legislature meeting tomorrow night, so we'll be talking a bit about this then, and then we're doing a town hall. I think it's at 4:00 on Wednesday that'll be focused on vaccines, and it'll be Dr. Evelyn, myself, and Jason answering a long list of questions that we've already gotten. So we're trying to start to get that word out, and there'll just be more coming as we move forward.
I read where the actual flu epidemic this year was down 98%.
Yeah, so flu reporting is an interesting thing because it's not a reportable disease. So, and most flu goes undiagnosed anyway because people just either tough it out, or even if they go to their doctor, the doctor will say, okay, here's some, take some over-the-counter medicine to get over the symptoms. So it's not a reportable disease. I think because of COVID, there's probably less doctor visits around people that might have the flu. You know, they may just be choosing to tough it out. They went and got a COVID test and it was negative, and they're like, okay, well, then I'm just gonna, you know, when the symptoms are over, I'll go back to being about. I also think that the things we're asking people to do about COVID, mask wearing, hand washing, distancing, will play a role on the flu. There's no doubt on that. So it's difficult because some of the, you know, the folks that don't, you know, don't feel like COVID is as big a deal. You know, they look at those flu numbers and say, oh, everything's just the flu. They're just calling it COVID. And it just adds to the challenge of trying to communicate about what's really going on. We're definitely paying more attention to COVID because, you know, people are dying at higher rates from it than anything else. So all of those things play a role in why the flu numbers are down.
Yeah, I like the idea of the flu numbers going down because people are washing their hands more and being more cautious. Maybe that'll be something that they'll be continuing as we move down the years. Just thought that was noteworthy to add in there.
Well, the COVID saliva test seems to be a problem with respect to the results coming back in a timely manner. I had an acquaintance who had the test, and she had a very difficult time trying to produce the spit in order to get enough spit to be analyzed. And then a week later, they said, well, we didn't have enough, or it was wrong, and she had to do it again. Is there anything new on that?
So the 3 milliliters of saliva is a lot until it doesn't seem like it's a lot until you have to produce it. But it is quite a bit. And for some folks, it is challenging. I would like to think that if somebody waited a week to hear about something, that was an outlier. We're generally seeing test results turned around the next day. There are some instances where the test is indeterminate, but we had that with every sample collection site, and then it requires a resample in order to get an accurate result. You know, so it's hard, Tom, to speak holistically off of, you know, one person's experience. But I do know they are on most occasions turning results around the next day.
Well, that's good to know.
Frank, how is the hospital managing?
They're doing okay. Obviously, that's the number that worries us the most, right? And you know, I think we were close to or at 30 recently, and certainly that's not stretching the capacity of the hospital by any means. But you know, we don't want those numbers creeping up, right? Because what hospitals ultimately turn into are ICU stays and then unfortunate death, right? So all of those things kind of follow each other. And so the more hospitalizations we have, you know, it increases the probability that folks might succumb to it. So, you know, no number is good when it comes to hospitalizations. They're still fine from a capacity perspective, but it's certainly not good news from a disease perspective.
Okay. Well, thank you very much.
Sure.
Next on the agenda was chair appointments for the year. I've had a chance to talk to Tom and Larry and Elise, and they've all graciously agreed to continue as chairs of each of the subcommittees. Elise will continue to co-chair with Sheila. That seems to have worked out well for both of them and certainly for us. So I appreciate that. And I appreciate Larry and Tom's willingness to continue for this year. So that's set. Unless there's any questions about that, I'll just move on to the agenda setting for 2021. We have a lot on our plate for 2021. Certainly the strategic planning process will continue, and we'll be involved in some level with all of that between the two departments. And as Frank mentioned, we'll be participating in some way in the public safety reform that Jason will be talking about next month. But I wanted us to just take some opportunity during this meeting to talk about other things we should be thinking about, other things that we should be educating ourselves about in the next year. So I just wanted it to be kind of an open discussion. Some of the questions I thought about are, what are we not paying attention to? What do you all want to understand more about? So those kinds of questions. A lot of this work happens in the subcommittees where we get presentations from different agencies and get a better sense of the system. But I think that there's some times when we may want to invite our own guests and have a discussion, a broader discussion about a certain issue. So what kinds of things do you all wonder about or think we need to hear more about?
Hi. I would actually like to hear more about the clinic and in particular how our staff are doing there. I mean, we're in such uncertain times right now, and I'm sure that people that are struggling with mental health in the past could be struggling even more so right now. And then people that have never struggled, are struggling more than, perhaps this is new to them. But I wonder, personally, how our staff are handling doing Zoom calls and the stress of COVID. Because I know times have changed, and there's just, I know amongst my colleagues, there's just a different feel in the air.
Paula?
I'd like to hear maybe from the Housing and Homeless Task Force about how things are going with the landlords not being able to kick people out at this point, and what's going to happen when that changes. If we're going to then have a huge number of people who suddenly don't have a place to live. And how that'll affect people who are living in buildings who are dealing with mental health issues.
Good point.
Does
Jan?
anyone know when the build will be Lakeview is doing?
Did you ask about the Lakeview building?
Yes.
Yeah, they're coming along. The project is still moving along.
Yeah, it says my internet connection is unstable as usual. But yes, that is what I asked.
Yeah, so
when is that due to open?
Yeah, the project is still continuing along and is on its schedule. I think one of the positives of this is if you're doing construction, there are people available to do that work right now. So I don't know when they're scheduled to open, but we can certainly find that out and have them give her an update of some sort.
Yeah, it would be nice to hear also about their plan, because isn't it not just people with mental health issues, but it's supposed to be a mixed population and some staff on site. So I'd be interested to hear a little bit more about how that will be managed.
Okay, that's a great idea. Yeah, that whole issue of housing has certainly been a priority area for us over the years. And there's some unique things going on this year. Good.
And like I said, I will be having a little chat with Jerry Dietz, so maybe I can impose on him to come to a meeting like this and enlighten us. So let's see.
Good. Yeah, maybe we can collaborate, Tom, about an agenda for that. That'd be
Yep.
great.
Well, he and I will have a little chat here coming up pretty quick. So,
Okay. Other thoughts that you're wondering about or feeling we're not paying enough attention to? So I'm hearing more understanding of what's happening in the clinic and the impact on our staff and the people we're serving regarding COVID, and some general housing and homelessness issues, particularly related to plans related to when the eviction times expire and what's going to be happening at that point. Okay.
I guess along that line, I would just put in my 2 cents about the future of Ithaca housing. It's a concern, I think, of most of us. And I guess just anecdotally, you see all these big new buildings coming into Ithaca and pushing out the old buildings, and the majority of them are high rent. And folks have been traveling, pretty far to go to work at Ithaca. Cornell community, has a couple of buses that run back and forth. I think that's further just going to push out, the middle, lower class folks from downtown Ithaca. I know Jerry Dietz, landlord, be interested to hear from him if he ever shows up. But that kind of concern is, I hear that from my constituents, as well as the, folks that, I see. Well, I used to see on the streets. Now it's mostly Zoom. That I think is getting too ritzy. And is that good or bad? Nothing I can do about, but an observation where people are not able to talk about not paying your rent and giving the landlord kind of a hiatus on kicking somebody out. But I think it's maybe more sophisticated than that to have others look at. I know others do, but maybe our board can coordinate some of that, or see how much of an outcry is really happening out there in our community.
Okay. Elise?
Yeah, well, related to that, I think, Stu, you've made me think about the fact that the staffing crisis in community-based agencies was a huge problem before the pandemic, and now is just an overwhelming problem that I don't think agencies can solve by themselves. And a lot of it, of course, is related to housing prices in Ithaca, because I know agencies like Racker Centers who operate houses in other counties that are more affordable say that they don't have the same level of staffing issues in the more affordable counties as they do here in Tompkins County. And I just think this is a cross-cutting issue in terms of, in particular residential services, but it really does put people's lives in danger. And so I think, if we could find some way to pay more attention to the status of that issue, and perhaps what the workforce development system might be doing about it or not doing about it.
I agree with that. And another offshoot of that is, I don't know of any particular agency that focuses on rural outreach. I think everybody does their own little bit of it, but it just seems like it's become more and more important as rural communities are more cut off from, from the structure that has all the services in town. And so I'm not sure exactly what I'm saying, other than I'd like to explore that a little more to see, is there somebody out there that's more of an expert about the rural communities and their needs? It just seems we should pay some attention to that.
Yeah, good point.
Well, one of the issues of concern that I have on the the agenda is transportation, and it has to do with rural housing, or, you know, out of town housing, because as is well aware that people are moving out of town because they can't afford the rents here. Well, if they move out of town, how do they get back into town to do their jobs and do whatever they're going to do?
Mhm.
This is a big issue,
It is.
and it's something that very seriously needs to be addressed. And I think we need TCAT and whoever to speak to us regarding this issue, and put them right in the corner and make them do something that's constructive. I think.
Mhm. And I think that we have, obviously, our target in our mission here is folks with disabilities, and I think this inordinately impacts them. So we have to keep that focus too. Shauna, are there any other county groups that are looking at some of these issues that we could partner with?
I mean, I think the person that I would say is most knowledgeable, quite honestly, is Liddy Barger. She seems to really be the go-to person at the Human Services Coalition. Also Danielle Harrington with Tompkins Community Action, or Lee Dillon.
Okay.
I just think that, you know, we've been creative as a community over the years. I remember first moving to town and there was no TCAT, and it was invented by, well, somebody got some money, and next thing you know, people were working on it, and now it's an integral part of our community. So nothing's impossible, well, almost. But if we put some energy towards it, I think it could be helpful.
And I think the beginning steps could be us really getting informed about the issue, hearing from people who are currently involved, and getting a little more educated about it. Okay. Well, that I really appreciate the input there, and I'll talk to Frank further about how we can maybe take some next steps and plan this to be part of our agenda in future meetings. So, and if you think of other things, let me know. We're a strong group of thinkers here. It'd be great to influence some of these tough issues. So thanks.
Yeah, and Marion, I would just share that I think all of the things you guys are talking about also impact the public safety reform conversation, right? And so I think that's what this collective group and all of the people you represent brings to that table. Because I think you know, there's so much focus on the law enforcement entities and their role, when we all know they're the end of the line, right? And we've missed all of the other opportunity to try to help people if our law enforcement folks are having to interact with those folks that we serve. So housing first, right? Making sure people know where they're going to lay their head and where their next meal is coming from. And then making sure they have all of the services that they need to be successful in their daily lives and live their best life. So I think there's opportunity to kind of bring all of that expertise and understanding about that to that larger public safety conversation. And I think we have an opportunity to move the needle on some of these things that we might not have had in years past. So, you know, you never want to be faced with these very difficult situations, but hopefully there's some positive that comes out of it, that we've got people's attention and we can really start talking about these things in a broader way.
Yeah, thank you. Paula?
One, I hope, small issue, but I was just wondering, Frank, if maybe at some point we might hear about the implications for the legalization of marijuana in surrounding states and how that might affect Ithaca.
Yeah, Paula, quite honestly, I think we're going to be hearing more about legalization of marijuana in New York during this budget session. So I think we're that conversation is going to be had just because of the financial implications that go along with it. And I think we have to make sure that our voice is heard, that we can't be using it to make up budget holes, because there's going to be cost to the health of our community that we need to account for and reinvest those dollars there, as I think both you and the Board of Health kind of elucidated in your letter that you wrote a couple of years ago. So yeah, I think we're going to be having those conversations, and certainly we'll bring whatever information we can find that would be useful.
Okay. Anything else on this? Okay, well, I think it's time to go into executive session to talk about some applications. We have a wonderful group of applicants, and the nominating committee will be meeting next week to review them and take some next steps regarding some of our openings. But we do have a couple of that we need to talk about tonight. So we will go into executive session. If I could have a motion for that.
So move.
Stu, and do we need to do something technically, Frank?
Yeah, you need a vote to
Okay,
go.
all in favor of going into executive session?
Aye.
Okay,
Okay.
great.
And now Greg will stop the YouTube, and then I'll pause the recording.
Good night.